Good evening. Muy buenas tardes. Before I thank Marta for that beautiful introduction, I want to send what is called un fuerte abrazo to my good friend, Tom. Tom, congratulations on your award. We've worked together for, I'm going to say, almost 40 plus years. And this award, Lifetime Achievement Award, is long overdue. So thank you for your friendship and for your support over the course of many, many years. And again, I may get a little political on you this evening. I need to say a few words. I need to say a few words about the ICE rates. Los Angeles is a city of profound and very real diversity. People from at least 130 countries call this home. It is also an immigrant city, and yes, a Latino city. I would not be here today if my parents had not pursued the American dream. AltaMed would not be here if I had not pursued the American dream. The patients, the families we serve, they too would not be here if it were not in pursuit of their own American dream. So as an immigrant, as a proud Mexicano, it breaks my heart to see what is happening on the streets of Los Angeles. No one deserves to live in fear. And unfortunately, the trauma this is causing would not disappear overnight. It would have long-lasting impact on the people we serve and the communities we call home. Think about the words of Senator Alex Padilla as he exit this afternoon. As he was interviewed, the only words he said, think about the community. If a U.S. senator is treated the way that I was treated today, think about the people in the streets of Los Angeles and how they are being treated. All right, I think that's all the politics I'm going to do for now. I may slip into politics again, but let me thank Marta for the beautiful introduction, and let me also take a moment to congratulate her. Just 6 months ago, Marta became the first ever Latina and the first ever woman to be CEO of LA Care Health Plan. There is absolutely no higher praise than see one of your own mentees flourish and achieve success. And I share this not only to celebrate her tremendous achievement, but also to raise awareness of this historical appointment and to call on you as healthcare leaders to act. Believe it or not, Latinas make up only 1% of C-suite executives in corporate America. They are also less likely to receive career advancement support and have a manager or a senior colleague advocate on their behalf for promotion. This needs to change. And as leaders, that deserves. And as leaders, we have the power to do so. Which is why it is so fitting that the theme of tonight's dinner is leading with purpose. You see, over the years, I have learned that leading with a clear sense of purpose is especially important during challenging times. Leading with purpose helps us navigate uncertainty. It helps us foster resilience and inspire us to take action. Because when individuals find purpose in their work and they see the impact they are having in the community, you not only are building a company, you inspire a movement, you cultivate purpose-driven leaders, and you build a legacy. This is why AltaMed exists today. And we need this kind of leadership right now, because we can all agree that our industry and our city is facing a tidal wave of disruption. Not only are we dealing with ongoing workforce shortages, but recently federal policy changes are also putting the health, safety, and well-being of millions at jeopardy, threatening vital public health programs such as research funding, healthcare equity, potentially depriving healthcare access to 13.7 million people. All the things that so many of us in this very room have spent our entire careers advocating for. But let me share some powerful and something hopeful, something to remind you of what is at risk if we do not take action. David Hayes Bautista, a good friend, director of the UCLA Center for the Study of Latino Health and Culture, recently held a briefing where he discussed how Latinos propel the growth of California economy. California Latino GDP has surpassed $1 trillion. Let me say that again. Latinos in California contribute more than $1 trillion to the state gross domestic product. This is historical. This is a historical milestone that confirms what many of us already knew. Latinos are not just participating in the economy, we are driving it. Without Latinos, California GDP would fall from the world's fourth largest economy to only the eighth. Latinos in California are growing the labor force 15 times faster than non-Latinos. We are earning more degrees, participating in the workforce, living longer, and contributing across every major industry, from finance to healthcare. Simply put, the future of California's prosperity depends on Latino growth. Investing in Latinos and other immigrant populations means investing in California's continued leadership and resilience. Our economy depends on these individuals, and we simply cannot allow proposed Medi-Cal cuts or coverage back rolls or back down, or I believe that the term is rollbacks, that's the term, rollbacks, to undermine the very communities propelling this progress. This bright future was put at risk just a few weeks ago. We are familiar with it, when the House cut nearly $800 billion from the Medicaid program. This will create a cruel and devastating reality, a perfect storm, if I may, for millions of Americans across every zip code: Black, Latino, white, Asian, children, pregnant women, low-income seniors, and individuals with disabilities. And now, California must now weather its own storm to make some potentially devastating decisions. In May, the governor's May revised budget included proposing changes to Healthcare for All initiatives, scaling back Medi-Cal's expansion, and requiring existing enrollees to pay a monthly premium. We are talking about an initiative that took 16 years of incredible work to make this a reality, that just a year ago we were so proud celebrating. I must also mention, and I hate to get political again, what has unfolded here in Los Angeles in just the last few days, because we should all be alarmed that these hardworking immigrants who are already at risk are losing their health care, now living in fear of being arrested, separated from their families, disappearing, becoming invisible. These are members of our community who drive our economy, whose children had the same dreams as your children and your grandchildren. Thankful to the people of Los Angeles, people in Los Angeles have stood up for peaceful protests. And let me tell you, what is depicted on television is not the reality on the streets. Peaceful demonstrations concerned for their neighbors have been met by the National Guard and threatened by the Marine Corps. All because a few bad apples take advantage of the courage of many of those people demonstrated. This is a very, very scary time in our country, but especially here in Los Angeles. Our community needs us to stand together with them to protect one another, because I want to be clear. These are not natural disasters. These are not acts of gods. These are storms. These storms were made by men and women with pens, budgets, and power. And we have power too. And we must decide, will we stand up? And I say, yes, we will stand up. Because our patients, the very people driving our economy, who will make us even stronger, but who fear for their safety, are counting on us to stand up. We must stand up because we cannot let our political power be washed ashore. Because together, we have made Southern California a national model for health access. We have proved that immigrant status should never stand between a person and the care that they need. We simply cannot go back. I think in this moment about the courage that our Los Angeles Unified School District Superintendent, Alberto Carvalho, he was once undocumented, homeless, and working harsh job just for a shot at the American dream. Today, he leads the second largest public school district in the country. He is responsible for more than 500,000 students. Students like him at their age may be undocumented or have parents who may be undocumented. He made sure that teachers, administrators, and staff were not deceived. He drew a line and said, schools are a safe place. They should be dedicated to learning. When Superintendent Carvalho stood up to his students, his remarks were not political. They were moral. I have been thinking about what he recently told the New York Times, and I'm going to quote, "When you are born poor, the state of mind never leaves you. If you were once undocumented, that level of concern for yourself and for others never leaves you either." We must have that concern for the people we serve. So tonight, I want to thank my family, first of all. I want to thank the Board of Trustees, the Board of Directors, and the staff of AltaMed. And congratulations, Tom, for receiving tonight's Lifetime Achievement Award. I want to stretch mine out just a little bit longer. I got a museum to build sometime in the future. And I want to thank the many, many friends in this room. Many friends in this room that I have known over the course of 40-some years. Thank you all very much. But more importantly, thank you for standing beside me, because the storm is here. That perfect storm is here. We need to work together to navigate the ship forward. And do everything we can do standing up for our patients. Thank you. Mil gracias.